previously what's known as the impartation genetic screening, or PGS, involves checking embryos for abnormalities in the number of chromosomes. Embryos with an abnormal number of chromosomes, known as aneuploid embryos, have less chance of developing into a baby, or less commonly may result in a baby being born with a genetic condition. So PGT-A identifies aneuploid embryos that are unsuitable for a fertility treatment. So to do the PGT-A, the embryologist remove a cell, or if at a later stage, several cells from the embryo, which it is tested for any chromosome abnormalities. The embryo can still develop with fewer cells if the removal of cells is done carefully. So that is important to very carefully these biopsies to don't damage the embryo. So PGT-A is now mostly carried out at the blastocyst stage, as I have already mentioned, on day 5 or 6. There is no evidence that PGT-A carried out at this stage is effective at improving your chances of having a baby for most patients undergoing IVF. But it appears possible that reduce the availability of embryos for transfer following PGT-A may counter any benefit of embryo selection in some cases, or in some patients that are candidates for this test.